ഇയർ പോയിൻ്റാണ് നമ്മളിന്നിവിടെ ഡിസ്കസ് ചെയ്യാൻ പോകുന്നത്. കേരള PSC DME 2021 എക്സാമിൻ്റെ ക്വസ്റ്റ്യൻ പേപ്പർ ആൻഡ് ആൻസർ കീ ആണ്. കോഡ് D ആണ് ഡിസ്കസ് ചെയ്യുന്നത്. പക്ഷെ അതിൽ നമുക്ക് എല്ലാ കോഡിൻ്റെയും ആൻസർ ഡിറൈവ് ചെയ്യാവുന്നതാണ്. ഇനി കാണാൻ പോകുന്നത് ഫസ്റ്റ് നമ്മുടെ ക്വസ്റ്റ്യൻ പേപ്പറിൻ്റെ ഫസ്റ്റ് പേജിൻ്റെ ബുക്ക്ലെറ്റാണ്. നമ്മുടെ ക്വസ്റ്റ്യൻ കോഡൊക്കെ ഉള്ള ബുക്ക്ലെറ്റ് ഡിസ്കസ് ചെയ്ത് തുടങ്ങാം. Palpable gallbladder in a jaundiced patient due to biliary obstruction, and the answer is B, that is Courvoisier sign. And second question, another name for osteitis deformans, the answer is Paget's disease. Then third question, which among the following is the correct sequence of referral system in Kerala? It is subcenter, primary health center, community health center, district hospital, that is option A. And next, fourth question, identify the nutrient of proximate principle. The answer is option A, that is carbohydrate, fat, protein, 1, 2 and 3. Then fifth question, how many megadoses of vitamin A are given in the vitamin A prophylaxis program? It is option C, 9 megadoses. Then sixth question, pentavalent vaccine is a combination of the following vaccine. Choose the right answer. The option is D, that is diphtheria, pertussis, tetanus, hepatitis B and Haemophilus influenza type B. Seventh question is, in WIFS program, the target age group is, the answer is option C, that is 10 to 19 years. Next is question number 8. A cervical cancer screening was conducted in a rural community among 1,000 adult population. During the survey, it was found that 8 women already diagnosed with cancer of cervix and 12 new cases of cancer of cervix identified. Estimate the number of prevalence of cancer of cervix in the community. The answer is B, 3.57. Then identify the public health functionaries at the public health center. It is question number 9. The answer is option A, ASHA, JPHN and PHN. Then question number 10, which is not a principle of primary health center? The answer is D, multi-dimensionality of health. Then question number 11, regular exercise is an example of which level of prevention? The answer is question number A, primary prevention. Then 12th question, which is not a barrier method of contraception? The answer is C, copper T. Then 13th, the expected weight in kg of a child at the age of 8 years is, the answer is option C, 30.5. Then question number 14, an informed consent given by a child below dash years of age is considered as invalid legally. The answer is option B, 12. Next question is question number 15. The age group who are at most risk for stressful experience as a result of illness and hospitalization. The answer is option A, toddler. Next question is question number 16. Giving other foods and liquids in addition to breast milk or non-human milk to an infant is option D, complementary feeding. 17. According to WHO recommendation in COVID-19 pandemic, generally children aged 5 years and below should wear which type of mask? Option A, no mask. 18. The age at which children can localize pain is, the option is D, greater than or equal to 3 years. Question number 19. A child having 18 kg weight is admitted with dehydration. What is the intravenous fluid requirement for 24 hours? Answer is option B, 1400 ml. Next question 20. The most common cause of cardiac arrest in infants and young children is option C, respiratory failure. 21. Most severe complication after fracture reduction in children is option B, compartment syndrome. 22. A child who is on immunosuppressive therapy can take live vaccine after 4 weeks, that is option B. What is the symmetrical enlargement of uterus in lateral implantation called? Question number 23. Answer is option C, Piscasek sign. The next question is 24. Which is the major galactokinetic hormone? Answer is option C, oxytocin. Question number 25. Where are the thumbs placed during chest compression in newborn? Answer is option D, lower third of sternum. 26. Which of the following statement is or are correct about prevention of perineal laceration? Answer is option A, including 1 and 2. Next question 27. What is reduced sperm motility known as? Answer is option B, asthenozoospermia. Next is 28. Which of the following can be done during assisted breech delivery? The answer is option C, only 1 and 2. 29. Which is the most conclusive clinical sign of pregnancy? The answer is option D, fetal heart sound. Next is question number 30. Which is the ideal time for episiotomy? The answer is option B, only 1 and 2. The next question is 31. Which of the following is done for the management of acute mastitis? The answer is option A, only 1 and 3. Next question 32. Which of the following is the immediate complication of pelvic inflammatory disease? Answer is option A, pelvic peritonitis and septicemia. 33. Which among the following is included in Henry Fayol's 14 Principles of Management? Answer is option B, discipline. 34. Which of the following is not an element of management? The answer is option C, commanding. 35. The period between placing the order and receiving the store. Answer is option D, lead time. Next is 36. The nurse patient ratio of an intensive care unit. Answer is option B, 1:1. Next is 37. The allocation of authority and responsibility to perform a selected task to a competent individual is known as. Answer is option C, delegation. 38. What is the type of relationship where there is a little input from group members? Is option A, autocratic. Question number 39. Which of the following is not a characteristic of a profession? The answer is option D, dependency. 40. False return report with an intention of harming the reputation of one person is known as. Answer is option B, libel. 41. Which ethical principle is followed in telling truth about the disease to a patient? Answer is option A, veracity. 42. Which type of budget outlines the purchase of large fixed asset? The answer is option B, capital budget. 43. Who stated that by education I mean an all round drawing out of the best in child and man in body, mind, and spirit? Answer is option B, Mahatma Gandhi. 44. Which teaching method is more effective in teaching procedures in nursing education? The answer is option D, demonstration. 45. Which of the following is a small group teaching method? Answer is option C, seminar. 46. Which of the following is a wrong statement about essay type questions? Answer is option B, more coverage of content. 47. Which of the following is a graphic teaching aid? Answer is option A, chart. 48. Which of the following is an example of quantitative study? Answer is option B, descriptive. Next question is 49. Which is the most frequently occurring value in a data set? Answer is option B, mode. 50. Which of the following is an example of probability sampling? Answer is option C, systematic. 51. Which type of variable represents outcome of the intervention in the study? Answer is option D, dependent. 52. Which of the following is a measure of central tendency? Answer is option B, median. 53. Which of the following forms the myelin sheath in the central nervous system? Answer is option C, oligodendrocyte. 54. Which cranial nerve innervates the lateral rectus muscle of the eye? Answer is option D, sixth, that is abducens. 55. Which of the following is a hinge joint? Answer is option A, elbow joint. 56. Which of the following cells secrete pulmonary surfactant? The answer is option B, type 2 alveolar cells. 57. Which of the following photoreceptor help in bright light vision? The answer is option B, cones. 58. Bacterial cell walls are mainly composed of. Answer is option A, peptidoglycan. 59. Which one among the following is a gram-positive bacterium? Answer is option B, Clostridium perfringens. Then 60. Bacilli are the term used for. Answer is option C, rod-shaped bacteria. Then 61. The term invasiveness indicate. Answer is option D, the ability of a pathogen to spread in the host tissue after establishing infection. 62. Which among the following statements is not true about the normal microbial flora of human body? Answer is option A. They can never become pathogenic even when host defense fail. 63. Father of psychoanalysis, that is option B, Sigmund Freud. 64. As per the psychosocial development theory of Erikson, identity and role confusion is associated with. Answer is option D, adolescence. 65. Ability to see beyond outward behavior and sense accurately inner experience of another at a given point is option B, empathy. Next, 66. Deficiency of serotonin causes. Answer is option A, depression. Question number 67. Ivan Pavlov is associated with. Answer is option D, classical conditioning. 68. Perception without stimuli. Answer is option B, hallucination. 69. Behavioral pattern of everyday life with unconsciously arises within a group is. Answer is option D, culture. 70. World Mental Health Day. Answer is option C, October 10th. 71. Government of India announced Year of Empowerment of Women in the year. Answer is option B, 2001. 72. Which among the following is not a type of marriage? That is option C, epigamy. 673. Indirect speech that is delayed in reaching the point but eventually gets from the original point to the desired goal. The answer is option D, circumstantiality. 74. Therapeutic communication technique where directing ideas, feelings, questions, or content back to the client so as to enable exploring their own ideas and feelings about a situation. The answer is option C, reflecting. 75. MSE means. The answer is option D, mental status examination. Question number 76. Word meaning schizophrenia is. Answer is option A, split mind. 77. Delirium tremens means. Answer is option A, severe alcohol withdrawal symptoms. 78. Lysergic acid diethylamide LSD is a hallucinogen. Option D, answer. 79. Intelligence quotient IQ 55 to 70 indicate. The answer is option A, mild instinctual deficiency. 80. A feeling of internal motor restlessness that can present as tension, nervousness, or anxiety. Answer is option C, akathisia. 81. Practice of gaining sexual pleasure from watching others when they are naked or engaged in sexual activity. Answer is option D, voyeurism. 82. When a person is unable to cope with the natural process of development. Answer is option A, maturational crisis. 83. The term nursing process was originally used by. Answer is option B, Lydia Hall. 84. Pupillary reflex is checked to find out the function of dash nerve. Answer is option B, oculomotor. 85. Tamoxifen is. Answer is option C, estrogen antagonist. 86. Dose of tenecteplase. Answer is option A, zero point 0.5 mg per kg. 87. Drug derived from streptomycin venculae. Answer is option C, chloramphenicol. 88. A patient is ordered 2 mg morphine. Available vial contains 10 mg per ml. Find out the amount of drug to be administered in ml. Answer is option B, 0.2 ml. 89. Percentage of oxygen delivered through red colored venturi mask is. Answer is option B, 40. 90. Depth of chest compression in adult CPR. Answer is option C, 5 centimeter. In most cases, point of maximum impulse PMI is at. Answer is option D, fifth intercostal space mid-clavicular line. Question number 92. What is meant by trough? Answer is option B, minimum blood serum concentration of medication. 93. Normal glomerular filtration rate. Answer is option D, 125 ml per minute per 1.73 meter square. 94. Cooper's ligament are located at. Answer is option B, breast. 95. Lycox catheter system is used to. Answer is option A, assess cerebral oxygenation. 96. Injection palmidronate is indicated in. Answer is option D, hypercalcemia. 97. Carpal tunnel syndrome is compression of. Answer is option B, median nerve. 98. Feltius syndrome is a complication of. Answer is option B, rheumatoid arthritis. 99. Volume of blood in liters pumped by the heart in 1 minute is option D, cardiac output. 100. Drug of choice in renal cell carcinoma is option C, pasopanib.